guys, we are super excited to be here with River Valley Home Health and Hospice. That's a whole mouthful. So I'm assuming you're just not a hospice agency. There's a lot of things that you do.
For sure.
What sets you apart? Well, no, let's start with who you are.
Love it.
Yes.
Yes.
I'm getting ahead of the game.
Awesome. Thank you for being here. My name's Matt Briggs. I am the executive director, a nurse by trade. I've been in the Mojave County area providing home health and hospice for the last 10 years.
Long time.
And yeah, just love to be able to be a part of the community, do something amazing, and get to work with, awesome people every day.
Amazing ladies, for sure.
Amazing people.
Your turn.
I'm Kristen Bragg. I started as a social worker and now I'm the community liaison for our company, and so majority of the time I'm marketing to our providers in this area, building relationships, and I am also doing all of the hospice consults.
And I'm Amy Devine. I'm the Director of Social Services, so I am supervising and the lead over our social support services like bereavement, volunteers, social workers, chaplains.
That's a lot. So let's really jump into what sets you apart. Obviously, there's a lot of hospice agencies in town, but you guys have the Home Health and Hospice, as well as the CARES Foundation. So there's a lot that goes into what you guys do.
Yeah. In the hospice piece of it gets a lot of notoriety and exposure in the community. It's a time in people's lives when you get one shot, that there's no room for error, that you have to have the most amazing team. And so I'll start there. We have the most amazing people. We recruit the best. We've been around 10 years and are doing nothing but continuing to get better every year. So we do have the best. And two wonderful examples right here, and Kristen and Amy. But more than that, the other side of it, and home health is actually a larger part of our business, that there's just more people that need help in getting back out in the community. It's an aspect of, it may be a short term, whether it's physical therapy or in-home skilled nursing, education, safety. Did you have a surgery? Did you have a fall? Young people that just having an episode or something that puts you into the hospital, but you're on that trajectory back into the community. There's a six-week period where you just might need help. That's where we fit, and helping people progress in their health is our specialty. River Valley, in the area, we're the only tri-state licensed, California, Nevada, and Arizona, highest quality Medicare, has a star rating system that in all three areas our outcomes are the best. We invest a lot of time, attention. As a nurse myself, I started as a home health and hospice nurse, that I've been able to see the entire process all the way through. So we're not just I, but the rest of the team is very passionate about providing amazing care, and that's what's going to keep us around for the next 50 years. So you can look it up online. It's publicly shared through CMS of the quality scores and amazing things that we do on home health and on hospice. But we also have a full therapy, speech, OT, PT that no one else in the area has, that we take that very serious. So not only are we awesome, we've got there's pretty much not a place or condition that we're not able and willing to jump in and treat. So
I like that you brought up that it doesn't just have to be, your 90-year-old patient that's on hospice. It really, any age group could really find themselves in need of your guys' things that you do.
Yeah, it is from whether it's pediatric to which is less common, but from any age group, that in that time of whatever the need is, a health condition, a change in any health condition, being aware, honestly, is the biggest challenge of what we do. That so many people need additional assistance, not just in the hospital from physicians, but when it's difficult to get into a provider, if you need a ride or if you're not feeling up to it strength-wise, that is where we fit. It's anybody and everybody needs help at certain times. So
I was actually on home health at one point in my life after a surgery, and I wouldn't have been able to come home and like leave the hospital if I didn't have a home health agency willing to take me and do the treatments that I needed at home. So it was such a godsend to me to be able to come home after being in the hospital for a month and having that support.
I think sometimes there's so many misconceptions. You know, people assume that with home health care, they're going to be there every day and they're going to invade their space, right? Or they're going to be judgmental. You know, we have seen it all. We've been in every environment, and there's no judgment here. What I love about our company, I think, and what sets us apart too, is that we are going to treat every individual that we come in contact with like they're our own family. And that's what I love about this company. It was home health care that saved my dad's life at one point. It was his home health nurse. And so the thing is like what's nice about having our home health nurses visit you at home when you do need that is that they can monitor what's going on with you. You know, yes, your doctor's there, but you see your doctor maybe once, twice a year. And then there's times when it is.
Being on hospice or, you know, when you're in those positions, sometimes we don't know what to do.
yeah, it's a really good point. And to the hospice palliative aspect of the care that we provide, it's not just about the patient. As I said earlier, it's a time in families' lives, in the patient's life that you only get one shot. You have to be your best all the time, which in that aspect, as a company and an agency, the focus on being the best employer to treat our people the way that they need to be treated so that they can be there for our patients is a huge focus of ours.
Well, you guys all have to carry a heavy emotional load, so that's...
It's physically, mentally, emotional. You don't survive in healthcare, let alone home health and hospice, if your heart's not in the right place for very long. And I think that's one thing I also love about our team is we're supportive of each other so that we can be out there in the community providing our best, but it's the entire family. And what that looks like is on our end, from the medical end, a 24-hour physician on call, heavily involved. Interdisciplinary group is what that is consisted of: the physician, a chaplain, social work, nursing, equipment, volunteers. That even though those are what is provided by hospice in general, and much respect to everyone that does that, but taking that even further, the amount of care, the additional programs that we provide with our foundation, people that aren't able to afford additional equipment or things that aren't provided, certain medications, whether it's palliation or not, evaluating those things carefully. Our bereavement program, we have dedicated bereavement counselors. That is another thing that sets us apart, that I don't know anyone else in the area that has one that's fully dedicated. Plus additional services like Full Circle, which is a program that we pay for additionally for our families that no one else does, that helps figure out after someone passes. There's so much death certificates, taxes, how do you navigate retirements, things like that, that it helps insurance policies. Mm-hmm. All of the things that you don't think about at the time because you shouldn't have to. Yeah, that it's a wonderful service to help wrap those things up.
Love the Full Circle program. I used it myself when my mother-in-law passed, and I didn't really understand what it was about, but they helped so much. They just walk you through every step that you need to take after someone passes, and it's such a burden off of you because you don't have to sit and try to research what do I need to be doing. They're there for you. They follow up with email. They help you contact places. So it's really amazing.
Yeah, it's something that you don't think about it till you need it, and that's what we're here for, for sure.
Well, it's nice to know. I'm sure that anybody that uses you, as somebody who's ill and that needs that help, to know that your family's going to have support either if it's because you're coming home or, the other side of not making it and needing the support that way. So if they needed to get a hold of you, or at what point do they get a hold of you? Where does that kind of start?
So basically, anytime a patient, let's say, could use assistance or they think they might need assistance in the future, I am always willing to have a conversation with them or their family, whether it's for home health or whether it's for hospice. All they have to do is call. You can call our office. I have a work cell. They can call me or even text me directly. You can always reach us via email. And it's very simple, but basically we'll get back to you right away. And I'm willing, like I said, to come to you or have that conversation via phone, whatever is more convenient. And really even just to answer questions.
I think that's a big point too. Also, just for a lot of people don't know what they need, but they just know that they need help. So if you have questions about anything, you are always, we encourage you to call, because, one of my social workers can help walk you through maybe the all text process or other community resources. If you don't meet criteria for hospice or home health, it doesn't mean you don't need help, and we're still able and available to assist in those things.
Does that always have to be the patient, or can that be somebody in the family?
It could be the family.
Anybody can reach out.
Yeah, anyone. Even in the community, if you know someone and you think they need help. I've had calls from community members. Can you call my neighbor? And I've called them, but yeah, that's what I love about our company too, is, of course hospice is a business, so is home health, but we're always putting the patient and the community first, and if that means spending time with someone that may not come on our service, that we're still willing to give back.
Yeah, I think that's something that I'm super proud of. We never hesitate. You don't need to be a patient of ours, but if you have questions, and I would encourage anyone, changing conditions, changing medications, even just planning for the future, that retirement age, that just asking questions, awareness of what's out there is the biggest obstacle. There are services, like what we provide, plus additional community resources that people just aren't aware of. We live in an area where we have limited resources in some aspects, but even the ones that we do have, a lot of people just aren't aware. And those are things that I'm super proud of, that we never hesitate to take the time and invest. We live here. We're proud of where we're at, and the place that the role that we play in the community, and love to help anytime that we can.
Yeah, it'll never be a bother for us. Everybody matters. You're not just a number. You're a person, and at least with River Valley, you're going to be treated as such. So that's what I love about it.
I love that. Well, and I'm sure, none of us are very good about being ahead of the game, so I'm sure most of the calls are the panic of this situation is happening, and I'm sure I would assume I'd be in the position of calling you guys just being like, I don't know what to do,
Exactly.
So,
and you'd be surprised how many people really don't know what hospice does or what home health does. I could get a community call where someone says, I need help with my loved one, my husband, and so what's going on? And you get the information. Have you ever thought about hospice? I didn't even know that they would be eligible for something like that. So, you just don't know until you know.
That's good, because I think that when you hear hospice, you almost think about deathbed kind of, and not realizing that it could be a longer or shorter term situation, depending on, you won't know unless you make that call.
Yes, there are so many misconceptions when it comes to hospice care. And that's why, it's my job when I have those conversations with families and the patients, I really like to really explain and educate to them how beneficial hospice can be, especially the sooner you accept those services than waiting too long, much more beneficial.
I think very important to remember too is that, yes, you guys are there providing help and services to the patient, but, sometimes the family wants to take on too much, and before you know it, now everybody's overloaded and exhausted, where you guys can just come in and really give that guidance and that help and that assistance, and you don't want to wait till you're at the point of exhaustion either.
Yeah.
That extra support is so great. Yes. Plus our volunteers are amazing, and it's so nice that they're willing to give respite to those caregivers that can be very overwhelmed. Yes. So
there's a lot of additional benefits that unless you've gone through it, it's hard to explain. That in that difficult time in any family's life, the dynamics of those conversations are hard. Depending on relationships or dynamics in people's lives, that it can be even tougher to have those conversations at the end of life. That our social workers, our nurses, that helping facilitate those types of conversations of even just accepting that this is the prognosis, that someone is going to pass, and how are you going to handle that, truly are some of the most beautiful aspects of what hospice brings, that unless you've experienced it, that it puts the family in the position to be family, not having to be a caregiver. Yeah, that it's just a dynamic that you wouldn't necessarily think about, that you feel obligated as a family member, and that it can help alleviate feelings of guilt, or even just being able to get the quality out of the time. That it really is a beautiful service, that
letting go of all those things that you're so worried about, being able to actually spend time with them. Right?
And I think too, like yesterday even, I had a wife say how grateful she was just to know that she has someone to call if she has a question, like about the medication or anything that's going on, because it's scary when you haven't been in the medical field, and you've got these medications. You're like, what do I do? So just having someone to call is just an enormous relief for the families.
Well, the address, the phone number, you guys actually have this new beautiful facility, which is pretty exciting. But that's all going to be on the page and the website that we got going on. Thank you guys so much for letting us come and visit.
Thank you.
Thank you.
They are just a phone call away. Again, I think if you didn't know, now you know that it doesn't have to be the end of life situation. It can really be questions and comments and concerns, and get the direction of where to go and where to start.
That's right.
for sure.
Yes. Hey guys, shop local, support local. Hopefully if you need them, call them. If you don't, that's great too.
We're here regardless.
Yes.
Yes.
Have a good day.
Nope, thank
you guys
you.
for showing up.